I thought I'd take a few minutes just to talk about arthritis since the first class finished it and the second class didn't. Okay, so arthritis, the name arthritis means inflammation or degeneration of the joints, and it's not always associated with the elderly. That's generally what we think when we say arthritis, but it can be wear and tear, it can be an acute arthritis versus a chronic arthritis. Acute arthritis usually has to do with some kind of infectious organism that gets into the joints, causes inflammation, but you're going to get over it. Chronic is, of course, longer term. And there are three different forms of chronic arthritis that I want you guys to know about. The first is what you would typically refer to when you said arthritis, like grandma's got arthritis or whatever. So it's called osteoarthritis or degenerative arthritis. And what it really is wear and tear arthritis. And you're seeing the picture here. So it can definitely and often does have to do with aging, because the more frequently you use your joints, the more likely they are to wear down. What happens in this degenerative arthritis is that combination of wear and tear, if you add in aging, lack of circulation, perhaps a genetic predisposition that involves less collagen in your cartilages than other people, then what happens is as your cartilages start to wear down, the bone will contact the bone. And what happens when you stress bone is that it increases in mass. And so first, this is just inflammatory, but later what happens is you actually have more bone tissue at the joints that restricts movements. So who gets osteoarthritis? Well, anyone gets it with wear and tear. So for instance, pitchers will get it in their shoulder, and tennis players will get it in their elbows, and slalom skiers will get it in their knees. But all of us, both genders, both sexes, will get it in old age, generally. And where do we usually get it? Usually our weight-bearing joints, hips and knees. Hips even more likely in women just because of the architecture of female hips. Also your distal phalanges. You see the distal phalanges here where you're actually getting it. More in the fingers than the toes because of repetitive movement. And really, what can you do about it? Really not much. Primarily, you just treat the pain that's associated with it with usually aspirin, some kind of a non-steroidal anti-inflammatory, ibuprofen. There are stronger versions of those, of course, but primarily treat the pain and the inflammation. Okay. The next one is far more serious. It's called rheumatoid arthritis, and rheumatoid arthritis tends to cause permanent deformation of the tissue. It's a chronic inflammatory disorder. It's an autoimmune disorder. What happens in rheumatoid arthritis is the synovial membrane, your immune system makes a mistake and starts to attack the synovial membrane. When you lose the synovial membrane in your synovial joints, you lose the fluid. When you lose the fluid, the cartilages smash against one another and they start to break down. And this tends to be progressive. The inflammation, of course, will cause fluid to accumulate in the joint, and that alone is painful because of the pressure. But then over time, if you continue to break down the cartilage, you're going to start to get scar tissue, replacing normal joint tissue, and you get permanent deformation of the joints. Sometimes, for instance, the synovial membrane doesn't ever come back, so you have this permanent deformation of the joints. So this one usually hits symmetrically. We don't know why. Like if it hits the right hand, it's going to hit the left hand, and usually small joints first: fingers, wrist, ankles, and feet. Mostly women get this one. Women are more likely to get all autoimmune disorders. There are a couple of hypotheses as to why that's true. I'll talk to you guys about that later this semester. And the treatment for this one, it can get more invasive. Usually in the early stages, they just try to relieve the pain, reduce the inflammation. Later, if the inflammation itself is really problematic, they can give you stronger anti-inflammatories like prednisone, which is a corticosteroid. And they can have surgeries. For instance, if you had this in your vertebral column, then the distortion of your vertebral column can actually compress your organs. So sometimes they have to go in and do surgery. But like all autoimmune disorders, there is no cure for rheumatoid arthritis, and it doesn't tend to be associated with elderly people. There's even a juvenile form of rheumatoid arthritis. Okay, and then the very last one, and oh, by the way, this is also rheumatoid arthritis. And then the very last one is gout or gouty arthritis. And gout is kind of, well, it's short course, but it's recurring. So it gets categorized into these chronic arthritis disorders. What happens with gout, got a couple of different pictures. That one actually goes up there. What happens with gout is we all produce uric acid as a byproduct of breakdown from nucleic acids and proteins in our diet. And some of us have trouble clearing it out of our bloodstream. Some of us produce more than others. And so what happens is when uric acid, it's a byproduct of nitrogenous waste, or it's a nitrogenous waste product. When uric acid increases in concentration in the blood, it tends to deposit in your soft tissues as crystals, sodium urate crystals. And when you put a crystal into a synovial joint and then move the joint, look at the massive inflammation and pain that can respond. So this is gout. This is also gout. This is gout. So the crystals in the joint cavity as you use it cause pain and swelling. This one is more likely to occur in men than in women, but it's evening up now. What it is, it used to be called the King's disease because, let's say in medieval times, a high protein diet wasn't something that everyone had access to. So typically high protein diets, high meat diets, for instance, were sort of the prerogative of king, the prerogative of the lords and the wealthy. And of course, historically speaking, if there was limited amounts of meat, the males usually got more than the females. This was not just the disease of kings, this was the disease of rich men. And now, especially in this society, we have pretty much equal access to high protein diets. So it's still mostly men who get it middle-aged and older, but we're evening it up. And so what do you do about this? Well, you have to do something. You need to either suppress the production of uric acid or increase the secretion of uric acid. Sometimes a dietary change is necessary. And sometimes there's actually a drug that you can take called colchicine, and colchicine helps break down the uric acid in your system. But it's kind of a metabolic predisposition. So if you get it once, a lot of times you will get it again, which is why it's considered a chronic disorder. It's not generally going to kill you, but it's pretty darn painful. Okay, that's all I have. There will probably only be one question on your test about any of the kinds of arthritis, but at least now you've all gotten a chance to hear them.